Just message me. If audio, video, everything is okay, just message a hi to me. Waiting for your call. Great. Hope everything is fine. Yes, I'm seeing in the YouTube window opened. Okay. So, which of the now we are going to discuss about virology. So, hope you already studied virology. We'll answer some MCQs and we'll discuss. Next 1 hour is go like this. Which of the following is an enveloped DNA virus? Fundamental and basics. Majority of the viruses are enveloped viruses. Okay, majority of the viruses are enveloped viruses. If we know the non-enveloped viruses, it is very easy. For example, we are classifying the viruses into two. One is called enveloped and non-enveloped. Based on the envelope, we have two: enveloped, non-enveloped. So again we are classifying based on the nucleic acid, DNA viruses, RNA viruses. So wherever less number of people are there, you remember that first. Easy to remember non-enveloped viruses. Non-enveloped DNA viruses are mainly 3 people. One is adenovirus, DNA virus, adenovirus, papovavirus, and another one is parvovirus. These people are non-enveloped. Where RNA viruses, usually enteric viruses, are non-enveloped. Any viruses causes severe diarrhea, fecal-oral route. Okay, remember the mnemonic CRAP. Calciviridae, Rioviridae, rotavirus, everything. Astroviridae, Picornaviridae, which includes poliovirus, Coxsackie virus, everything. Picornaviridae. All these people are non-enveloped. So no need to remember enveloped. Apart from these viruses, everything is enveloped. Make it easy. Yes, Muhammad Mustafa. Your answer is, which of the following is an enveloped DNA virus? The question is, enveloped DNA virus is hepatitis B virus, because adenovirus is non-enveloped. DNA virus, parvovirus non-enveloped, papillomavirus comes under papoviridae, non-enveloped virus. Got it? Make it easy. Hepatitis B virus. You are right. Hepatitis B virus. Next is okay. Right. Next is, which of the following virus has segmented RNA? Another basic question. So RNA viruses, we have a single strand RNA, double strand RNA. Apart from that, positive sense, negative sense. And one more classification is called segmented RNA. Segmented RNA viruses. Can you give the mnemonic of segmented RNA viruses? My mnemonic is called ARBO. What is Orbo stands for? Arinaviridae, Rioviridae, Bunyaviridae, Orthomyxoviridae. What is the advantage of segmented RNA? I mean segments in RNA. They can move here to there and they can easily undergo genetic reassortment. They easily undergo genetic reassortment. Genetic reassortment. Okay, genetic reassortment. Easily they can undergo. And how many segments are there? You remember, I used to tell write in alphabetical order. This you write in alphabetical order like this. A, B, O, R. Arena, 2 segments. Bunya, 3 segments. Orthomyxo, 8 segments. Rio, 10 to 11 segments. Rotavirus. Number of segments. Number of segments. Easily you can remember. Easily you can remember. Always you have questions from basic. So which of the following virus has segmented RNA? Influenza virus. It's nothing but orthomyxovirus. It possesses 8 segments. It possesses how many segments? 8 segments. Great. Next is, which of the following viruses exhibits latency in sensory ganglia? Latency is the feature of herpes virus. Mainly. Many other viruses are there. Latency, herpes virus. We are classifying the herpes virus based on latency. Can you name the classification? We have alpha, beta and gamma. Alpha settled in ganglions. Alpha settled in ganglions. Okay. Beta virus settled in secretory glands. Latency in secretory glands. Gamma, latency in lymphoid tissues. Gamma in lymphoid tissues. Alpha ganglion, beta secretory gland, gamma lymphoid tissue. Okay, example, here we have human herpes virus 1 usually settled in trigeminal ganglion, human herpes virus 2 sacral ganglion, human herpes virus 3 sensory ganglions. Secretory glands, human herpes virus 5, 6 and 7. Human herpes virus 5, 6 and 7. Lymphoid tissue, human herpes virus 4 and human herpes virus 8. So ganglion 1, 2, 3. So here 3 is there. Go for 3 is the answer. Go for 3 is the answer. Human herpes virus 3. Because 5 settled in secretory glands. 4 usually latency in lymphoid tissues. HIV usually CD4 cells like that. Got it? Latency over ganglion is human herpes virus 1, 2, 3. Human herpes virus 1, 2 and 3. Next is, which virus is associated with Kaposi sarcoma? Direct question. Epstein-Barr virus, it is otherwise called human herpes virus 4. It associated with Hodgkin's lymphoma, non-Hodgkin's lymphoma, Burkitt's lymphoma, Hodgkin's, non-Hodgkin's, Burkitt's lymphoma, like nasopharyngeal carcinoma, all. Cytomegalovirus, it associated with congenital infection, transplant infections. Human herpes virus 8, we call it as Kaposi sarcoma. This virus associated with Kaposi sarcoma, we call it as KSV, Kaposi sarcoma virus. We call it as Kaposi sarcoma virus, KSV. If anybody is having Kaposi sarcoma, if we do the HIV test, found to be positive. Okay, found to be positive. Human herpes virus 8, human herpes simplex virus, HSV 1 and 2. HSV 1 and 2. They cause congenital infection, meningitis, many things. Meningitis, keratitis, many things they cause. So virus associated with Kaposi sarcoma is human herpes virus 8. Got it, my dears? Got it? Right. Next is what is the most common cause of viral bronchiolitis in infants? Very simple question. Children less than 1 year of age. Most common cause of viral bronchiolitis is respiratory syncytial virus. Influenza virus causes pneumonia, especially in adults. Parainfluenza virus causes croup in school-going children. It's pneumonia in adults. Acute respiratory syndrome, pneumonia usually in adults. Adenovirus causes pharyngoconjunctival fever, especially in adults. Pharyngoconjunctival fever in adults. So respiratory syncytial virus, which belongs to Paramyxoviridae. Paramyxoviridae, it's the most common cause of bronchiolitis less than 1 year of age. Less than 1 year of age. Respiratory syncytial virus. Next is 4-year-old child presents with fever, conjunctivitis and a maculopapular rash starting on the face and spreading to the body. What is the most likely diagnosis? Very simple. Nowadays the case definition fever and rash is suggestive of measles. Case definition, new case definition. New case definition for measles is fever and rash, especially maculopapular rash. The rash we call it as maculopapular rash. Old definition was CCC, cough, coryza, conjunctivitis. Cough, coryza, conjunctivitis. cough coryza conjunctivitis. Okay, cough coryza conjunctivitis. Right. Anything you can type? You can type, my dears. I can see the messages. Okay. Next is cough coryza conjunctivitis is the old thing, but that are the features. Cough coryza conjunctivitis also other features. And in the oral cavity, you can get Koplik spot. You can get Koplik spot. In the oral cavity, you can see oral cavity Koplik spot. So, fever, conjunctivitis, maculopapular rash. Most likely diagnosis, we can go for measles. Rubella produces blueberry muffin rash. Varicella usually produces pleomorphic rash, multiple stages at one point of time. Pleomorphic rash. Next is great, Dr. Shruda. Which virus causes fifth disease? So which virus causes fifth disease, which is causes sixth disease? You should know. And it's a direct question. Everybody aware of that. Fifth disease caused by parvovirus B19. It is otherwise called Roseola infantum. Or Exanthum subitum. Roseola infantum, otherwise called Exanthum subitum. This virus is single-stranded RNA virus. Sorry, DNA virus. Very important. Single-stranded DNA virus. It targets erythroid precursors. It targets erythroid precursors. Targets erythroid precursors. Single stranded DNA, erythroid precursors. Okay, right. What about other total 6 diseases? Also, you have the curiosity to learn about other diseases also. What are the other diseases? So, usually these called viral exanthems and bacterial infection also. Childhood exanthem, we call them as childhood exanthem, is 6 people. First disease is, always remember, measles. Name, first disease is measles. Second disease is scarlet fever. Second disease is scarlet fever. Third is rubella. Fourth is, previously it was called Duke's disease. Okay, Philatov-Dukes syndrome. Now they removed it. It is not in the classification. There is no fourth disease now. Usually they thought Staphylococcus is the agent, but no, not now. Fifth is erythema infectiosum, parvovirus B19. Parvovirus. Sixth is Roseolum infantum, human herpes virus 6. Roseola infantum, otherwise called exanthum subitum. It is caused by human herpes virus 6. This is caused by parvovirus. Measles caused by measles virus, rubella caused by rubella virus, don't worry. So these are all the first 6 diseases. Okay, here the question is 5th disease, parvovirus. Rubella causes 3rd disease, measles causes 1st disease. Got it? No confusion with rash appearance. Measles, the rash appear on the 4th day, like that. Okay, right. Next is, always you may have a question on hepatitis B in your university exam, Viva, as well as in your MCQs. So, which is the serological marker indicates active hepatitis B infection? Active hepatitis B infection. Please remember, anti-HBs indicates protection, vaccination. Envelope antigen indicates hepatitis B. Envelope antigen indicates high infectivity. High infectivity. Vaccination, high infectivity. Very good, Dr. Shruda, you're right. Core antibody IgM, it says disease of the infection, disease status, acute, chronic, like that. Active infection present means hepatitis B. Surface antigen indicates active infection. It indicates active infection. Active infection. Yes, you are right, Miss Manoj Yadav, Shruddha, you are right. Okay, so these are all the serological marker indicates active hepatitis B. You should know all the markers. For example, anti-HBe indicates low infectivity. Low infectivity. Surface antigen, active infection. Surface antigen, active infection. Got it? Next is, live attenuated vaccine is used of the which of the following viruses. So it's time to remember live vaccine and killed vaccine examples are very important. Live vaccine and killed vaccine examples are very important. Try to remember killed vaccines, inactivated vaccines. Automatically other people are live vaccine. All people are live vaccine. Okay, what are all the inactivated vaccine, types of vaccine? Live, mainly using killed vaccine, live attenuated vaccine, subunit vaccine. Apart from that, we have DNA vaccine, everything is the latest. But these three are common. In our country, we have killed vaccine, live attenuated vaccine, subunit vaccine. Classical example for subunit vaccine, hepatitis B vaccine, and all kind of polysaccharide vaccines, pneumococcal vaccine, meningococcal vaccine, Haemophilus influenzae vaccine, all. So polysaccharide. These are all subunit vaccine. We are using a part of the cell, surface antigen or like this, polysaccharide capsule. Next is coming to this side. Can you give the example for killed? Follow my mnemonic. You know my mnemonic? What's my mnemonic? Because killed means they will not come back. Rest in peace. Always rest in peace, Jack. Yes, Manoj, live vaccine contraindicated in immunocompromised, including pregnancy, you should not give. If you want to give some emergency, some condition, there is separate protocols are there. You need to follow those protocols. Okay, see carefully. Killed vaccine, hepatitis A vaccine, rabies vaccine, influenza vaccine, injectable, killed vaccine, polio, injectable polio vaccine or Salk vaccine, Japanese encephalitis virus, Nakayama strain. Japanese encephalitis virus, Nakayama strain. All these people always rest in peace. Jack is my mnemonic. Always rest in peace, Jack. So, rabies, influenza, these two people are killed. Hepatitis B belong to subunit vaccine. So, live attenuated vaccines or other vaccines, including measles, mumps, rubella, all other vaccines are live attenuated 17D vaccine. Okay, all other vaccines are varicella vaccine, live attenuated vaccines. So easy to remember, killed vaccine. The mnemonic is always rest in peace, Jack. Always rest in peace, Jack. Got it? Pertussis you cannot say because it is acellular vaccine. Pertussis nowadays we are using acellular vaccine also. We are taking a particular component of the cell. Okay, then diphtheria, tetanus are toxoid. It is not live, it is not killed. We take the toxin and we deactivate the toxin. Toxin converted into toxoid. Got it, my dear? Right. Yes, MR and MMR live. You are right, Manoj. MR and MMR are live. Great. Next is, which are the following vaccine given post-exposure? Because this is a very clever question. Vaccine usually we think to prevent the disease. Acceptable. Usually we give it in childhood like that. But some diseases after exposure we can give vaccine. Because usually after exposure there is no use of vaccine. After exposure there is no use of vaccine usually. But few conditions are except condition. Few conditions are except condition you can use vaccine after exposure. That's called post exposure. Mainly you can see a disease called rabies and hepatitis B. Hepatitis B and rabies you can give. Okay. So MMR vaccine, measles, mumps, influenza, before exposure you can give. Rabies vaccine post exposure. We have a regimen called post exposure regimen. After dog bite you can go for vaccination. After dog bite, after exposure. Same way hepatitis B also post exposure prophylaxis available. We have two type of vaccine. One is intradermal regimen and one is intramuscular regimen. Intradermal is called Thai Red Cross regimen. Intramuscular is SN regimen. So what are the difference here? Intradermal we have 4 doses 0, 3, 7, 28 days. In case of SN regimen 0, 3, 7, 14, 28 days. Yes, very good, Dr. Shruda. Thai Red Cross regimen, updated Thai Red Cross regimen. You are right. And SN. SN 5 doses 0, 3, 7, 14, 28 days. Updated Thai Red Cross regimen just 4 doses 0, 3, 7 and 28 days. 28 days. So you must know about rabies vaccination also. Next is, what is the drug of choice for herpes simplex virus infection? If you have any doubt, you can post in the chat box also. I will teach. I will teach if you have any doubt to interact in microbiology, especially virology today topic. In virology, if you feel any doubt or anything, just you can post. I will throw light on it. Don't worry, my kids. What is the drug of choice for herpes virus? So only few viruses are having drugs. Okay, herpes virus drug is acyclovir. Acyclovir is the drug of choice for herpes. Excellent, excellent, Manoj. Oseltamivir, drug of choice for influenza. Ribavirin, we are mainly giving it for respiratory syncytial virus. Zidovudin, it's a drug HIV, hepatitis B we are using. Ribavirin, HIV, hepatitis B we are using. Got it? Hepatitis, HIV, this thing we are using, ribavirin. Great. So you must know the drug of choice for viral infection, because very less number of viruses are there, but less number of viruses are having antiviral drugs. Majority of them we have no antivirals. Next is, which virus transmitted by Aedes mosquitoes and can cause microcephaly in neonates? Microcephaly and Aedes mosquito. What else come to your mind? Microcephaly is Zika virus. Basically, it is Flaviviridae. Vectors are Aedes mosquito. It causes microcephaly. Yes, 75 milligram oseltamivir. You are right, Manoj. Dengue virus also Flaviviridae. Vector is Aedes mosquito. Chikungunya belongs to Togaviridae, but vector is Aedes mosquito. These people usually causes pain. Dengue means bone pain, breakbone fever, saddleback fever, everything. Chikungunya means joint pain, effusion, joint pain. Yellow fever virus also Flaviviridae. Vector is Aedes mosquito. So Aedes is a vector for many diseases. Zika, dengue, chikungunya, yellow fever. Many places Aedes is the vector. Aedes is the vector. Got it? Yellow fever. Everything become yellow. Mainly causes liver failure. It produces councilman bodies, mid-zonal necrosis. Councilman bodies, mid-zonal necrosis. We call it as councilman bodies, mid-zonal necrosis. Next is, which virus associated with cervical cancer? Direct question. Hepatitis B associated with liver cancer, liver carcinoma, hepatocellular carcinoma of liver, hepatocellular carcinoma. Epstein-Barr virus, already I told, it causes nasopharyngeal carcinoma of Chinese people. Yeah. Winmon is answer says is cytomegalovirus. Usually it causes congenital infections. Epstein-Barr virus also causes a disease called kissing disease. Otherwise called infectious mononucleosis. Kissing disease or infectious mononucleosis. So human papilloma virus associated with cervical cancer. especially serotype 16, 18, 31, 33, mainly associated with human cervical cancer. Human cervical cancer. Human cervical cancer, mainly associated with human cervical cancer. Human papillomavirus. Carcinogenic virus. Yes, Akash Shri Sendil. Class already started. Almost we completed 13 question. Virus causing German measles is. Please remember, German measles is nothing but rubella virus. Now it comes under maternaviridae. Rubella virus, maternaviridae. That's called German measles. Measles virus causes rubeola. Maternaviridae. Classical feature is rash. Appears mainly face and blueberry muffin rash with lymphadenopathy. Lymphadenopathy. Mumps virus, lymphadenopathy. Mumps virus causes mumps, parotitis, pancreatitis. Parvovirus B19. Parvovirus B19. It also produces blueberry muffin rash, but slapped cheek appearance. The rash is slapped cheek appearance. Slapped cheek appearance rash. Slapped cheek appearance rash. Blueberry muffin rash or slapped cheek in parvovirus. So rubella virus. It causes congenital rubella syndrome. Rubella virus causes congenital rubella syndrome. More damage in the first trimester. Congenital rubella syndrome, more damage in the first trimester. People can face a lot of damages. The fetus can face massive damage in first trimester. Okay, 85% the damage will be there. Next is hepatitis D virus infection recurs co-infection with which virus? Hepatitis D virus is a dependent virus. I used to tell it belongs to Delta viridae, and I used to tell, remember D for D, dependent virus. It dependent hepatitis B virus. It needs hepatitis D virus needs, yes, orchitis, you are right. Needs hepatitis B virus for its outer coating, envelope marking, many things. Okay, needs hepatitis B virus. It causes two type of infection. One is hepatitis B virus and hepatitis D virus. We call it as co-infection. Second category, hepatitis B virus followed by hepatitis D virus infection. We call it as super infection. We call it as super infection. One is co-infection, another one is super infection. Superinfection is more danger than co-infection. Superinfection is more danger than co-infection. Okay, always we have questions in hepatitis, HIV and herpes. Always used to tell in the class also, remember H, herpes, hepatitis, this thing. Yes, great. Which co-receptor involved in entry of HIV into the host cells? Remember I shown in video to you. HIV attach with CD4 cell with the help of two CD4 receptor with two co-receptors. One is CCR5, another one is CXCR4. We shortly call R5 or X4. So this is the CD4 cell. It has a receptor called CD4 receptor along with co-receptor. This virus comes and attaches like this. This is GP120 surface pellicle and this is GP41 transmembrane pellicle. So attachment with GP120, fusion with GP41. Fusion with GP41. Easily it can. This is the way it got attached. Okay. So you should know, for example, SARS virus attached with ACE2 receptor. Herpes, ICAM. Like this. For example, rabies virus, acetylcholine receptors. So each virus can attach with a specific receptor. Epstein-Barr virus attach with CD21 or complement receptor which is present on the B cells. It targets B cells. It targets B cells like this. Okay, so you should know the co-receptor or receptors involved in attachment of viruses are important. We call it as viral receptors. I'll make a post in my group, in my Telegram group. I'll make a post of viral receptors. I'm noting down in my paper. Okay, right. Next is, how many types of dengue serotypes available? Dengue virus, everybody knows it is Flaviviridae. Single stranded RNA, positive sense, enveloped, icosahedral symmetry. These are all features of flavivirus. Dengue virus. Vector is Aedes mosquito. Vector is Aedes mosquito. How many serotypes available? We may get a direct question. How many serotypes available? Totally it has 5 serotypes. Previously people say 4, now it is 5 serotypes. Den 1, Den 2, five serotypes. Dengue 1, 2, 3, 4, 5. 5 serotypes present. You should know about the dengue virus because and other viruses which are occupying the headline newspaper, you should know. Chandipura virus, human metapneumovirus, like that. Okay. Next is, which virus causes Ebola hemorrhagic fever? Ebola hemorrhagic fever caused by Ebola virus. Everybody knows. But here, it belongs to which family, which virus? Ebola virus is nothing but Filoviridae. It is filamentous virus. helical symmetry. Filamentous virus, helical symmetry. Okay, helical symmetry. And it comes under bioterrorism category A. Mode of transmission, direct contact with fluids and sexual contact. And usually it's spread from animals to human, chimpanzees to human being, then human being to human being. This is called Ebola hemorrhagic fever. It's a bioterrorism agent, category A. Bioterrorism agent, category A. Next is JC virus associated with which disease? John Cunningham virus. John Cunningham virus. Okay. It associated with, it's called polyoma virus. So remember, human papilloma virus, Papoviridae. We call it as Papoviridae, which include 3 viruses. One is called papilloma virus. Papilloma virus, we call it as human papilloma virus, causes cervical cancer. Next is polyoma virus. Polyoma virus. Example, BK virus, JC virus, those kind of people. Third one, simian vacuolating virus, SV40. Simian vacuolating virus. Okay, polyoma virus. It comes under polyoma virus and it is associated with PML, space occupying lesion in the brain, progressive multifocal leukoencephalopathy. Very good. Very good. Abhimanyu, Shrudha, Manoj, everybody answered well. Progressive multifocal leukoencephalopathy, PML. It is space occupying lesion. In this MRI, you can get a ring enhanced lesion. CJD, these people are called slow viral disease. Even subacute sclerosing panencephalitis, all these 3 people are called slow viral disease. SSP is the complication of which virus? SSP is a complication of measles virus. It is measles virus. Aseptic meningitis caused by many people. Majority of the viruses, herpes virus, echo virus, herpes, Coxsackie, echo virus, all people causes aseptic meningitis. Aseptic meningitis. Which of the following viruses causes molluscum contagiosum? Molluscum contagiosum. Molluscum is a disease. It is central application with a pearly white material. It is caused by pox virus. Papilloma virus causes wart-like lesions. Plantar wart, other wart-like lesion, and it causes cervical cancer. Parvovirus B19 causes 5th disease, erythema infectiosum. Adenovirus causes hemorrhagic cystitis. Epidemic keratoconjunctivitis. No problem, Abhinav and Yadav. learning is important. Qualification not a barrier. If you want to learn, it is related to medicine. It is related to microbiology. If you want to learn microbiology, you can learn. Even in the 25 questions, if one or two questions helpful to your day-to-day practice, great success. Okay. Right. So, adenovirus causes epidemic keratoconjunctivitis. Epidemic keratoconjunctivitis. Pink eye, people call it as. And it causes infantile diarrhea. It causes infantile diarrhea. Like this, you should know about the viruses causing important diseases. Adenovirus also causes pharyngoconjunctival fever. Pharyngoconjunctival fever. Got it? Great. Next is, what is the most common viral cause of myocarditis? Wherever myocarditis, most common cause, always remember. Okay, all these people cause myocarditis to a certain extent, but most common cause is Coxsackie B virus. Is the most common cause of myocarditis or viral myocarditis. Bacterial myocarditis caused by many people. You can get Legionella, Corynebacterium diphtheriae, many people causes. Okay, so myocarditis caused by many people. Most common cause is Coxsackie B virus. It also causes Bonham disease. Severe pain, just turn, pricking pain. We call it as epidemic pleurodynia, otherwise called Bonham disease. Epidemic pleurodynia. Bonham disease, epidemic pleurodynia. Okay, Bonham disease, epidemic pleurodynia. Got it? Cytomegalovirus, everybody knows it causes congenital infection, CME retinitis in HIV. Epstein-Barr virus, I told many times. And influenza virus, it causes acute respiratory distress syndrome, pneumonia. Yes, death. You're right, Manoj. EBV causes Hodgkin's lymphoma, many things. Nipah virus, most commonly transmitted humans via. General question. Even if you read newspaper, you can answer. They give more elaborately in the newspaper than textbooks nowadays. WhatsApp University. If you join some group, people keep on forwarding all the things. Whether it is useful or not, people will forward. That's all. They never keep anything in their hands. Okay. So, usually Nipah virus source is fruit bats. We call them as fruit bats. Usually they bite the contaminated food, especially palm sap, date palm sap. When human eats, very good. When human eats the dates, they will get. After that, it goes to human to human. Sometimes it is taken by pigs or like animals. Then pig to human, human to human. So it can spread either from the pig or the ideal source is bats. From the bat, it eat fruit bat. It eats the what is called palm dates. When man eat the dates, those dates, then they develop the disease. After that, man to man by inhalation or many other sources. Man to man by inhalation and many other. Next is, which virus associated with hepatocellular carcinoma? Hepatocellular carcinoma associated with hepatitis B and C. Hepatitis B and C, they associated with hepatocellular carcinoma. Remember, hepatitis B and C, they causes CCC, chronicity, cirrhosis, liver damage, mosquito malaria. What question? Direct contact with infected humans, Ebola. Rodents, even you can have hantavirus. Rodent excreta hantavirus. If you want, you can add. So, carcinoma. Remember, chronicity, cirrhosis, carcinoma by hepatitis B virus as well as hepatitis C virus also. Both can cause chronicity, cirrhosis and carcinoma. Next is a 2-year-old child, very important, presents with severe diarrhea and dehydration. Stool antigen test reveals double stranded RNA virus. That's a clue. One and only double stranded RNA virus which causes diarrhea, infantile diarrhea, is rotavirus. Double stranded RNA virus is rotavirus. Norwalk virus belongs to calicivirus. It causes diarrhea in adults. Adenovirus also causes infantile diarrhea, but it is double-stranded DNA virus. Astrovirus is RNA virus. Single-stranded RNA virus. So, one and only double-stranded RNA virus is rotavirus. Okay. Last question. Human metapneumovirus. Yes, update. Human metapneumovirus respiratory infection most closely resembles. Human metapneumovirus belongs to Paramyxoviridae. Paramyxoviridae. It is single-stranded RNA, negative sense, enveloped with helical symmetry. It mimics like disease as well as infection, everything closely seen with respiratory syncytial virus. Even parainfluenza virus also belong to Paramyxoviridae. Okay, it closely resembles with respiratory syncytial virus. Okay, that's all. Now the time is exactly 7:59. 1 hour 25 questions. Exactly we have completed these 1 hour questions. Okay. So time to sign off. Any doubts you can follow me in my group, Telegram group Micromagics. Okay. Any doubt you can post. All the best for your exams. Stay tuned for more updates in microbiology. Thank you very much. God bless you.